Assalamu alaikum, my name's Nyrah, I'm a GP pharmacist and I'm your host for today's health show on British Muslim TV. And today's topic of discussion, we will be talking about something very important, a topic that's very close to my heart, breast cancer awareness. Now, it was Breast Cancer Awareness Month in October last year, but I thought it would be very important to touch on it again. Now, breast cancer is one of the most common forms of cancer in the UK, and 1 in 8 women are actually diagnosed with cancer in their lifetime. It's really important we're aware of what the signs and symptoms are and what to do when these signs go detected. Now, to talk about Breast Cancer Awareness Month in more detail, I've invited a very special guest. Her name is Dr. Sesay, and lovely to introduce herself to you guys. Hi, Dr. Sesay, how are you?
I'm very well. Assalamu alaikum, everyone. Thank you so much for having me. As Nyrah said, I'm Dr. Aziza Sesay. I'm an NHS GP. I've been a doctor for over 10 years, and I am all about health promotion and education and prevention. So I run a platform called Talks with Dr. Sesay, which is literally about that. So I'm really excited to be here, and I think these sort of programs are extremely important for our community.
Definitely. You know, I'm so excited to actually have you on the show. You know, a lot of questions to discuss, and I think a nice beginning question would be is, you know, what is breast cancer?
Yeah, and a very important question as well. So breast cancer is what happens when you have abnormal cells in your breast, which then divide to form even more abnormal cells, which eventually forms a growth that we call a tumor. And that's what we usually feel as a lump.
Perfect. And, you know, there's so many myths around different cancers online. And one myth I actually came across was breast cancer only occurs in females. You know, is this true? Can it affect men?
Yes, this is a common myth that a lot of people believe. And the fact is that, yes, breast cancer is very, very, very commonly occurring in women. In fact, 99% of all breast cancer occurs in women, but 1% does occur in men. And what I wanted to emphasize here is that anyone who has breast tissue has a risk of getting breast cancer. So that means everyone, because even men have breast tissue, which they don't usually know about. And it's only a small amount, and the amount varies depending on the man. And it's often behind the nipple. So yes, breast cancer does occur in both men and women. Anyone who has breast tissue is at risk of developing breast cancer. And this is why it's really important that you know what's normal for you, because the risk is there.
Definitely. You know, it's so important then for both men and women. You know, they know their bodies, they notice any changes in their bodies. And also, you know, if there is any symptoms, you know, if it feels it's quite abnormal, to speak up about them and really, you know, kind of monitor how long they're actually going for. Now, just in terms of, you know, signs and symptoms, in terms of signs, you know, what should we actually be looking out for when it comes to breast cancer?
Okay, so when we talk about symptoms and signs, the common one that everyone mentions is a lump. And I wanted to emphasize here that, yes, one of the symptoms can be a lump, but that's not the only thing that can occur. You need to look for whether you have any change in the size or shape of your breast, whether there's a change in the skin texture of the breast. So sometimes it can look like it's dimpling, like the peel of an orange, whether there's any redness or a persistent rash along the skin, or even the nipple. Examine the nipple itself, see whether it's changed in the shape or in its position, whether it's gone inverted when it wasn't before, so it's gone in on itself, whether you're getting any nipple discharge, so it could be bloody, it could be green discharge without squeezing, and you're not lactating, whether you notice any constant pain in your breast and your armpit, and whether there's any swelling in your armpit or in your collarbone as well. Those are the common things that could mean that you may have breast cancer, but I also want to emphasize here that it doesn't mean that you definitely have breast cancer. What I would like anyone who notices these changes to do is please, please, please come and see us, come and see your doctors, your GP, so that we can assess and we can examine and we can refer you accordingly.
Such an important message, you know, to always speak up if you do notice anything wrong. You know, NHS, you know, we might be under a lot of stress in terms of being overworked, but when it comes to cancer, it's a serious thing, and we'll always, prioritize patients based on their signs and symptoms. Now, in terms of causes, I know there's a lot of money and funding going into the research behind, breast cancer itself. They haven't actually come across many causes, but are there any particular risks that they've decided on, or any link to the onset of cancer in the breast specifically?
So absolutely, you're right. What we call risk factors, which are the things that increase your chances of developing breast cancer. There are a few. We've already mentioned one. Unfortunately, being a woman is a high risk. 99% of all breast cancers occur in women. As you get older, increasing age increases the risk of breast cancer. So 80% of all breast cancer occur in women over the age of 50. Not to say that it doesn't happen to women who are younger, but it does increase the risk as you get older. Obesity, so being quite overweight, increases your risk. And this is because you have more sex hormones in your body, which then have a link with increasing the risk of breast cancer. Smoking and alcohol also increase the risk because they increase your sex hormones. If you have a family history, so if you have someone who's a close relative, of what we call first-degree relatives, so this is either your parent or your sibling or your daughter or children, then that increases the risk of breast cancer by 2 times. But saying that, it doesn't mean that because you have a family history that you're guaranteed to have breast cancer. So I wanted to reassure that 85% of people actually who have a family history of breast cancer don't end up having breast cancer. But I also wanted to say that even if you don't have a family history, so 87% of people who have breast cancer don't have a family history. I just wanted to mention that fact. There's also the link with faulty genes. So there are genes called BRCA1, BRCA2. If they've mutated, that increases the risk as well. Also, there's a higher risk in ethnicity. So if you're Caucasian, it does increase the risk. If you don't exercise regularly, if you have a lot of dense breast tissue, really thick breast tissue, that increases the risk by 3 to 5 times. The age that you have your period, so if you're younger when you had your period, or if you have your menopause, which is when the periods end at an older age, that increases the risk as well. If you've never breastfed, all these things can increase the risk of breast cancer.
Sure, very insightful. I think, just to kind of summarize, I think it's definitely a mixture between, both genetic factors and environmental factors. Both play a hand in hand when it comes to the onset. And you mentioned before, there are, I think, different types of cancers, and some lumps you actually shouldn't be worried about. What are the different types of cancers that are within the breast tissue?
Of course. So, obviously, you hear the word cancer, automatically you're going to be nervous, you're going to be worried, there's so many things associated. But yes, like you say, there are different types of breast cancer. So the 2 main types that they categorize is non-invasive and invasive. So when we say non-invasive, that basically is the cancer, it doesn't have the ability to spread yet. So it's basically staying within an area. There's something called ductal carcinoma in situ. So we have ducts inside our breasts which carry the milk out into the nipple, and that's usually where cancer starts. So when it's non-invasive, it's just the cells within the duct have cancer. And the good thing about that is it's not, at the moment, it's not spreading anywhere. So it has a higher curative rate. And then you have non-invasive types of breast cancer, and there are quite a few of them. And all that means is that they have the tendency to spread, and they may have already spread, and they can be more difficult to treat. And the prognosis for those ones can, depending on when they find, so what stage of the cancer it is, they can be poor in the prognosis. But this is why it's really important that we try and find the cancer early. And there are a few things that we can do with that. And one of them, which I really want to emphasize on, is examining our breast, the self-breast examination.
Definitely. In part 2, actually, we'll be doing a self-breast examination demonstration. I think that'd be great to really teach the viewers how to properly check for lumps. You know, some people might view videos online, others might not know nothing at all about how to check for lumps. So I think definitely part two, that'd be great for the viewers to learn and listen from. Now, coming to diagnosis now, say, you know, a family member has, you know, their loved one's been diagnosed with cancer, you know, what advice would you give to that family member that's going through that alone? You know, is there any support groups that they can go to?
So are you saying the family member has been diagnosed, or they have a family member who has cancer? So is this the patient themselves or the family member?
Yeah, any family member that knows someone in their family or close friend or relative that has been diagnosed.
Yeah, so obviously that it's a difficult time for everyone, but there are so many different support groups available. The Macmillan support team are excellent. They have counseling services as well, and also just talking about it with your relatives. I think one of the things that people find really hard and uncomfortable is that difficult discussion, but having those discussions, being there for the patient who has cancer and allowing them to talk, listening to them, that can make such a massive difference as well. You also have Cancer Research UK. They have the call lines, the support lines as well that would be supportive. And usually getting research from reputable sites like Cancer Research UK that I've just spoken about, or Breast Cancer Now, Breast Cancer Org. There's a lot of information there that can hopefully reassure you. And we're here too as GPs. If you are finding...
Exactly. Yeah, thank you so much, Dr. Sesay. Sorry to cut you off there. We will be going to a break very soon, but join us again for part two, where we're talking a bit more about breast cancer diagnosis, a bit how it's actually treated, and what resources you can actually use online for further help. We'll also be doing a demonstration on how to check for lumps correctly and safely. Join us again for part two. See you soon. Welcome back after the break. My name's Nyrah. I'm a GP pharmacist and I'm your host for today's health show on British Muslim TV. Now, in part one, we actually introduced our amazing guest, Dr. Aziza, and we were talking about Breast Cancer Awareness Month. More specifically, how to check for lumps correctly and what are the signs and symptoms of breast cancer in general. It would be great to actually start part two, going through a demonstration on how to check for lumps correctly. Dr. Aziza, lovely to have you back on.
Thank you. It's lovely to be back. Okay, this is my favorite part because it's so important, and this is what we all need to try and do as regularly as possible, at least once a month, so that we know what our normal is, and we understand our body. Because if we know what our normal is, we understand our body, then we are more likely to pick things up when they're going wrong. Okay, so I'm going to start demonstrating one way to do a breast examination, but I have to emphasize here that there's no hard and fast rule. Try this way if it suits you, but just do the way that works as long as you're doing certain things, okay? So the first thing I would say is look, okay? So you're going to look at yourself in the mirror, and you'll undress from waist up, including your bra, and look straight ahead, and you're going to be examining yourself in three positions. So with your arms on your side, and then on your arms on your hips, hands on your hips, and then your hands above your head like this. And you'll be looking at the front of your breast, and you're looking for the changes that we mentioned in the first part of this talk. So if there's any nipple changes, any skin changes, any rash, any lumps, and so on. And sometimes what I do is I make sure I look to the side, and then I also I lean forward so I can see the front. And sometimes what I do is, I brought this here to help with the demonstration, is I would if you're quite well endowed, I'd always lift the breast up to make sure that I examine underneath the breast as well to see if there are any of those changes. So after we've done the looking part, we move on to feel. Okay, so you can either do this lying down, you could do it whilst you're standing up and you're examining in front of the mirror, or you could do this in the shower. Some people prefer to do it in the shower because that's where you're rubbing soap on your body anyways. So what I would advise you do is you divide your breast into 4 areas, right? 1, 2, 3, 4, so that you can concentrate on each area. And you have one arm above your head like this. And then you want to use the flats of 3 fingers, these ones. And you'll be feeling around, including the nipple, like that, all around. All the 4 areas of the breast, okay? All 4 areas. And then you make sure that you also include your armpit and your collarbone, your shoulder tip, and also the center of your chest. You want to feel all those areas to see if there's any changes at all, any tenderness, any lumps or bumps. And if you find anything or something that's changed, something different, then we do encourage you, please, to go and see your GP. It's most likely not anything sinister, but it's better to be safe than sorry. The other thing I wanted to say is after you've obviously done one side, you always need to feel and compare on the other side. So if you find something on one side, but then you feel the other side and it's at the exact same spot, that may just be the normal for you. But again, the only way you know it's normal is by doing it regularly.
That was a brilliant demonstration. 10 out of 10 for that. I think that was really informative, really easy to follow. Are there any online resources of any PDF documents that you could actually refer our viewers to, just in case they haven't got this show on record and aren't able to go back to it?
No, of course. But I'm going to plug myself a little bit. I do have a demonstration on Instagram, but there's an organization called Cup of Feel. There's an organization called Cup of Feel. They're really brilliant, and they're aimed towards younger audiences, but it doesn't matter because essentially what they're doing is they're trying to encourage more and more people to examine their breasts regularly so that they know they're normal. Breast Cancer Now is another breast cancer organization that's brilliant, and it also has some tips on there. And what you can do, because some people find that life gets in the way, you forget, don't you? So Cup of Feel that I mentioned, they have an app that you can use where they remind you to do your breast examination. And there's another one called Know Your Lemons, or if you want, you could also set a reminder on your phone to remind yourself. And there are loads of different breast examination available on YouTube that you can access. But the reputable ones that I said, just in case, Cup of Feel, Breast Cancer Now, those are the ones I would say that you have a look at, or talk to Dr. Sesay on Instagram. I have a 30-second video that you can watch on how to examine your breast.
Oh, perfect. No, I think, definitely the whole awareness of breast cancer, cervical cancer, it's duplicated year on year. The breast cancer community now has gone so strong. There is actually so many support groups out there. So many different charities out there that are raising money and awareness of breast cancer. I think the other day when I was actually in the changing rooms of a hot local retail store, I saw on the mirror there was signs to actually check for your breast. So you can really see the importance of detecting breast cancer early has really bloomed in recent years. And just moving on towards the diagnosis of breast cancer, if you're going to the doctors, you found a lump, what would you expect from a consultation with your doctor? What is the actual referral process?
Okay, so what would happen is you see us. We would ask you to tell us about your symptoms, how long it's been going on for, how it's changed, if it's changed, and if it's anywhere else, if you have a family history. And then we'll ask your lifestyle as well, whether you smoke, the things that I mentioned before that increase the risks of breast cancer. After we've gone through all of that, and we'd also ask and encourage you to express your concerns. If breast cancer is something that you're worried about, do tell your doctor. Let us know where you're at. And then we would examine you, we'd always examine you as well. And how we examine is very similar to what I've explained to you, except you'll be lying down on the couch when it comes to the feeling area. And we will compare each side and we'll look for the abnormalities that you've mentioned. Even if we can't find the abnormality, but you're very convinced that there's something there, or if we have found the abnormality, we would then refer you to the breast clinic. So if we found something, we would refer you under what we call the 2-week wait breast clinic referral. And that's where you get seen in clinic. You have what we often call the triple test. So you would have the breast examination done by the specialist, and you would then also either have an ultrasound scan or a mammogram. These are 2 imaging of your breasts, and then they might do a biopsy as well. If when you've come to see us, we couldn't really find anything, but you're still concerned, we can still refer you to what we call the non-urgent 2-week wait breast referral, sorry. And in that regard, you get seen again. You may have these scans done or not, but it will hopefully give you peace of mind, because ultimately, like Nyrah said, it's about finding the cancer early, because once the cancer is found early, it definitely increases the prognosis significantly. So if the cancers that are found early, over 90% of them, 90% of women who have cancer found early will survive over 5 years. And that's reduced significantly to 26% in patients where the cancer has been found late.
Wow, yeah, no, very important statistics right there. And, it is important to also note that, treatments for breast cancer have advanced tremendously. We're talking about new drug therapies, new types of advancements in the scans, mammogram scans actually used to detect early stage cancer. Doctors are now actually taking a very personalized approach when it comes to treating women actually diagnosed. I think that's the most important thing when it does come to treatment, is that all patients are actually being treated holistically. Touching on the topic of treatments, what are the kind of first line treatments for someone diagnosed with breast cancer?
Yeah, so what they would normally do, first of all, is stage the cancer. And when I say that, it's to see how it's progressed, whether it's spread anywhere, and that then varies in how the person will be treated, and also depending on the person's age. So for instance, if it is a young person who is of childbearing age, who would want to have children, they would discuss the potential of freezing eggs and so on and so forth. But with regards to treating the cancer itself, it varies again depending on the stage, and as you say, depending on the patient and what the patient would prefer. They would either do chemotherapy, radiotherapy, surgery, and then there are also what we call targeted hormone therapy and targeted biological therapy as well. And there's also a medication called bisphosphonates. So you may have a combination of these treatment measures that I've mentioned, or it would be one or the other. And as I say, it's very, very dependent on the individual.
Sure. And I think you mentioned the survival rate as well, earlier. Is there any, up-to-date stats or any information about, the survival rate of breast cancer today?
Yeah. So the most up-to-date stats, and this is from Cancer Research UK, is that 85% of women diagnosed with breast cancer will survive 5 years or more. And also, it's predicted that at least 75% of women who've been diagnosed with breast cancer of late will live 10 years or more, hopefully. And it's so important to mention as well that breast cancer survival has improved immensely, as you say, over the years. In fact, in the last 40 years, the survival rate has doubled. So, like you say, with regards to all the research that's being done, please do continue to fundraise and support these charities, because it's because of these charities that there are the advent of these treatments, which means that people are living a lot longer.
Definitely. And a very important message there to always kind of support these charities, as research is important and it's only ever going to grow more advanced in the future. I think that comes towards an end of our show, Dr. Aziza. Thank you so much for coming on. I think it's been really insightful for a lot of viewers out there. You know, health anxiety's been on the rise right now. So I think it's so nice to really educate our viewers on how to check their breast properly, safely, and what to do. Join us again next week where we're talking about a different topic of discussion. I will be talking about living with dementia or maybe even children's health. Tune in to find out. Thank you so much for watching. My name is Nyrah. Good night.